Okay, we're on, everyone. So for those of you who haven't seen me before, my name is Mary. I'm the health educator at Arthritis, New South Wales. So located in Crow's Nest. If it's your first time here, welcome. Super excited to see you tuning in here. We have a really exciting month ahead of us. We're covering all things to do with pain, psychology, mental health, and we're kind of taking a deep dive into that relationship between pain and stress. So it's a really interesting topic. Feel free to ask as many questions as you have that pop up. I will ask, though, for you to pop those into the chat box, because what we'll do, we'll have plenty of opportunity at the end of the session to revisit some of those questions that arise. So today we're focusing on understanding pain. Just to let you know that all our presentations here contain really general information and advice. So we do make sure that what we're presenting is evidence-based, it's accurate, reliable. If you do have questions that go back to your individual medical condition and your treatment, I will always direct you to a health professional, but I'll do my best to help you out with any questions that pop up. So today we're covering a few different things in the realm of chronic pain and touching on the psychology of the experience. The idea is that today is going to be a nice segue into next week's webinar, which is about mental health. And then towards the end of the month, we focus on mindfulness, the power of that. And we also have a really exciting guest speaker who will be touching on different breathing techniques to help with the practical applications of stress reduction in this context. So today we're just going to be introducing pain, the different types of pain. We'll be taking a deep dive into the psychosocial model. So we'll be looking at that psychology there. And then we'll be talking about some management essentials. I'm going to open the floor to you all, and I'm going to ask you, can emotions and stress influence pain? And if you have experience with this, what have you noticed? Do you recognize they exist together? Have you had this experience?
I think it does.
Yeah.
Yeah. I just because I can the two come together. I've noticed that when there's been a lot going on, I'm stressed, then my knees play up more. So I'm just assuming. And food maybe, yeah, but mainly stress. When I'm overwhelmed, I think.
Yeah.
Yeah.
Interesting to have made that observation, and I'm sure there are many other people in this group here that can actually resonate with that, and they've experienced the same things. Catherine, you have your hand up.
The opposite.
We can't hear you all that well, Catherine. So maybe what I'll encourage you to do is just type it in the chat box, and we'll have a read of what your experience is here. I will move into the next slide now. So thank you for sharing that, Julie.
Sorry, can I just see if this is heard better? I'm just saying that I'm the complete opposite, where as a consequence of my conditions, I don't feel pain, which is quite dangerous. The more stress and the more impacts, the more dissociation and the less connection with sensory input I have. So I just wanted to be clear that we don't all fall into the same box.
Absolutely. And that's going to be a key message that we're going to continue to reiterate through today's session, Catherine, because everyone experiences pain differently. So you'll hear that message over and over again. So I'm just going to do a little bit of true and false with everyone. Pain relates to how much tissue damage you have. Might get you to type true or false in the chat box. False. False. I guess absolutely correct. And I guess to some extent it's false. For some people, pain is absolutely related to tissue damage, but pain can also be influenced by many other different factors like emotions, past experiences, stress, and neurological processes as well. And this is why we lean towards false. Chronic pain means there's ongoing tissue damage or a sign of deterioration. This is kind of related to that first question. False. And absolutely correct for those saying false. Chronic pain can definitely persist after initial tissue damage has healed. It doesn't necessarily indicate ongoing tissue damage or deterioration. What about pain medications? Do they always solve the problem? True or false? It's interesting when we talk about pain relief, they definitely have their place when it comes to ongoing management of pain, but they don't always address that underlying cause and they don't always solve the problem. In addition, they can have other side effects and they're not always effective for all types of pain. And so imaging can always show you where pain is coming from. This is the realm of research that particularly interests me. You know, we have very advanced imaging techniques these days, like MRIs, X-rays, that can sometimes show you what's happening in terms of structural changes in the joint. They don't always provide a clear picture in terms of being that source of pain. So our key message here is that pain can be really complex and multifaceted, and we're going to take a deeper dive into this. Pain, I'm sure you can all appreciate, is a very common, very universal symptom with arthritis, but everyone's experience of pain is quite unique and it's different for everyone. Some people feel it come on intermittently with certain activities or tasks, maybe in certain weather conditions. Some people notice their joints are flaring up a little bit more in the winter times. And then you have other people who can feel it very much constantly and more severely. And there's a lot of ways to describe it, but at its very core, pain, it serves as an alarm system for the body. So pain is meant to alert us to potential harm or injury. And although it's a very normal part of being human, it can be a really unpleasant experience. And so in conditions like osteoarthritis, why it causes pain for some people and hardly any pain for other people is very interesting. And this is because our knowledge and understanding of arthritis, pain, joint health has evolved over recent years and it is continuing to evolve. And I guess that's why we do what we do here, to share with you those updates. So just to start this session off, I want to take a look at the different types of pain that exist. And for some of you, this might be, revisiting what you already know. For other people, it might be completely new to this. So we have different types of pain. We have nociceptive pain, pain that you can imagine getting from touching something very hot. So if you put your hand over the stove, that could be nociceptive pain. If you get a bite from something, if you're running down the stairs and you trip over and you sprain your ankle, this kind of pain is very sudden, very immediate alarm system in your body. Another type of pain is inflammatory pain. So where there's inflammation in the joint, there's usually a number of chemicals being released at the site, which also have a role in sensitizing nerve endings. So in conditions like arthritis, the inflammatory processes are what can lead to swelling, redness, and pain in affected sites. The more complicated pain, and this is where it gets very layered and complex, is called neuropathic pain, which results from damage or dysfunction of the nervous system itself. And this comes about rather than from direct stimulation of pain receptors by those inflammatory chemicals or tissue damage. So in people with osteoarthritis who have this, the pain can often be explained by changes in nerves and changes in the way they're responding to certain stimuli. And so you have some people who might experience pain due to things like loading on the joints. If you're carrying excess weight and there's more force on the joints, that could be extra load that's putting stress on the joints. Other people might have pain due to inflammatory processes in structures like the bones and the joint tissues. And so when we talk about acute pain, we're referring to the very everyday common pain that might last a couple of days up to a couple of weeks. Chronic pain is different again in that the mechanisms are a lot more complex. Chronic, it just simply means ongoing. So your chronic pain means that the pain is sticking around for a long time, but it also doesn't exactly tell us why or how bad it is. Sometimes this kind of pain can actually start in the brain and it feels like it's coming from a specific body part, even though nothing is definitely wrong there. And I want to use an example to highlight this. So has anyone heard of phantom pain before? And the consequences of that phantom pain? So some people who have lost a limb, they might actually still feel pain in that missing limb because the brain still thinks it's there and it's hurting. So this kind of pain is very real, even though it's not caused by any kind of damage in that body part. You know, it's still very much affecting quality of life and daily activities. So conditions like fibromyalgia or ongoing back pain can be similar in the sense that the pain doesn't have a very clear physical cause, but it's very much still felt and it's very much still impacting. So the challenge here is lying in when it lies in figuring out what exactly the brain perceives as a threat and what the brain needs to work towards healing, whether it's inflammation, structural changes, or is it the brain? It's not that you're actually making up pain, it's that the brain is actually creating the pain. So this is where we talk about it being a very complex sensory experience. Now, I don't want to make this too complex here, but I do want to just give you a brief overview of what's going on in the body. So our bodies are equipped with a very complex network of sensory receptors that detect different stimuli and transmit signals to the brain. So it's communication between a particular site and the brain. And these, I guess, sensors allow us to perceive things like pain, touch, temperature, and they're specialized to respond to different types of stimuli, which are located throughout our tissues, including skin, muscles, bones, joints, internal organs. So when you have knee osteoarthritis and you're walking, and all of a sudden you get a strong onset of pain, in osteoarthritis, it's sometimes those mechanical sensors that exist in that site dialing up the signals from the joint to the brain and perceive normal walking movements to be quite painful. We also have a chemical component. So when the joint's been damaged and it's been injured, it has some underlying disease, the body actually has this remarkable innate ability to, you know, attempt to reheal itself. But unfortunately, some of those mechanisms involved in that and those chemical mediators can have a role in sensitizing the nerves that lead to almost enhanced feelings of pain. We're going to come back to that as well. And so often in osteoarthritis, we have mechanical components, chemical components. In rheumatic and rheumatoid arthritis and other autoimmune diseases, the mechanisms are more complex again. So when it comes to pain, a lot of the signals are interpreted by the brain. And it's when the brain turns on that alarm system, it's activating a whole bunch of different things that work together to try remove that danger or instigate the healing. And so where does persistent pain stand with arthritis? First, I guess people with arthritis can feel acute pain, and it's due to tissue damage and that general disease process. So there could be irritation in the or pain in the back, the knees, the hips. It could be pain that comes about when you're not moving. So that synovial fluid that exists between those joints hasn't had the chance to move around and lubricate those joints. It could be a flare-up of your rheumatic autoimmune condition. So until recently, pain has always been largely attributed to joint damage and tissue damage. And what we've realized is that the things don't always add up. And it's because we've discovered there are central changes involved. When we talk about central changes, we're talking about changes in the brain and the nervous system. And we know this because there are other symptoms or conditions that can't exactly be explained by a tissue problem. So if we're thinking about fatigue, insomnia, multifocal pain in areas that aren't commonly affected by arthritis, multifocal pain just refers to pain coming about from different areas of the body simultaneously. And so what we know is that osteoarthritis is likely a mixed pain state where you have the nociceptive, the physical elements of pain and central elements of pain. And this means that there are contextual aspects that can also contribute to the pain that we experience. And so there are mechanisms that can actually increase the sensitivity of nerves. And so things that I guess used to hurt even more. And this is what we call hyperalgesia. And then they can also make normal things that didn't hurt before hurt now. So that's called allodynia. Now, the journey into chronic pain and everyone's experience with it is very, very different. And this is where I want to take a deep dive into the psychology. And I do want to take a look at, where it can start for some people, starting from childhood. Again, this doesn't really apply to everyone, but it's currently the understanding of the evidence that exists on the psychological component in pain. So in childhood, our brains learn to watch out for danger. Some kids are confronted with challenges, conflict, hardship, trauma. This can include really scary health stuff for a child, like big surgeries, injuries, wrong diagnoses. And so when children are faced with these kind of stresses so early in life when their nervous system is developing, it can actually cause changes in the way they respond to stress later on in life. And some children even develop learned behaviors that result in a very continuous state of tension and vigilance within the nervous system. So what this means is that the brains can become super, super protective and super sensitive, which can make the brain and nervous system, more sensitive to pain, which can make it feel even worse. And this is why as adults, when we're stressed, overprotective brains and nervous systems can actually be linked with physical problems. So things like headaches, stomach aches, digestive problems, tense muscles, joint pain. So big life changes like breakups, moving, losing someone we love, all these things have the potential to make physical symptoms worse. And sometimes our nervous system gets to a point where it's too sensitive and even small things can cause a lot of pain. So this can cause things like migraines, fibromyalgia, or just feeling generally tired, achy all the time. So our brains are pretty good at picking up habits, and unfortunately, pain can become a habit. The more we feel pain, the easier it is for our brains to actually make us feel it again, even if there's no real danger or there's no real problem like tissue damage. Chronic pain affects everything in life. It can affect hobbies, it can affect social life, it can even affect things like how we feel about ourselves. And so, you know, one of those things is, you know, things that used to make us happy can become really hard to do, while fear and stress get dialed up and get worse. So not only that, as the brain and nervous system changes, there are activities that, once we're able to provide natural pain relief chemicals, so we all know about endorphins and our happy chemicals, they're usually produced when we do things like exercise or movement or engage in activity that we really enjoy. Our bodies become less capable of stimulating the release of those. And when we don't have the production of those happy chemicals, you know, we don't get that same natural pain relieving effect in the body. And so to break free from the cycle of chronic pain, our logical brain plays a really big role here. Just understanding how pain can work can actually give you that rational part of the brain a boost. It's almost like giving it that little bit of a pep talk to step up and take change. And it's also about making that nervous system feel safe again. But in order to do that, we do need to take that role and approach in figuring out what's made it feel unsafe. And so there are a lot of science-backed techniques to help you do this. Guided writing exercises, teaming up with a health professional. They're there to help you understand the journey into chronic pain. And once you understand that, it can give you a roadmap out of it. And this is why it does involve a little bit of a process of rewiring neural pathways. It takes trying out new things, being consistent, and having patience. And so there are professionals to really guide you through this journey. And so this is why science-backed techniques like cognitive behavioral therapy can be really, really powerful. Learning about pain, engaging in meditation and mindfulness. There's all these things you can do to actually help that nervous system relax a little bit. So with this new understanding of pain, it's actually a way to teach your old nervous system new tricks. Things like finding joy, playing, being grateful, staying active. All these things are able to release natural pain relieving happy chemicals. So the more we practice these habits, the more at ease our nervous system will feel, which can sometimes be really, really powerful for reducing physical symptoms like pain that coincide with stress. So undoing chronic pain, it's not to say it's a quick fix. It's not to say there's one solution for it. It does take a lot of time, patience, understanding, but it's definitely one of those things to add into your toolbox. So joint pain, again, it varies from person to person. Some describe it as a grinding feeling, almost like rough surfaces rubbing together. Others can describe it as stabbing pains or a constant ache. So these descriptions show how our bodies interpret signals from nerves when something's wrong with our joints. When we talk about our joints grinding, it's almost like when worn out tires make a grinding sound on the road. Similarly, when cartilage wears down in our joints, it can feel like the bones are rubbing together, causing pain and discomfort. But what's interesting is that there are no actual pain receptors in cartilage. So this is why we think it's a bit more complex than just the loss of cartilage. Pain from joint grinding can come from a lot of different sources, like surrounding tissues, such as changes in the joint lining, changes in ligament, tendons, muscle weakening. Could also be attributed to inflammation within those tissues, which can trigger pain signals to the brain. For some people, that cartilage deterioration, it starts a chain reaction of pain. But then you have other people who could experience the same changes without feeling any pain at all. So in conditions like arthritis, the body's pain system can become really overactive. So processes that normally reduce pain might not work as effectively for some. And pain signals in the brain can actually get stronger and stronger, making it feel worse. So this sensitivity plays a really big role in the pain felt by people with osteoarthritis, rheumatoid arthritis. While you have some people who might not feel pain as much, it doesn't mean it isn't there or not causing damage. It just suggests that the joint problems alone aren't fully explaining that pain experience, and these people have different central mechanisms involved. So when we look at the biopsychosocial model of pain here, we know everyone experiences pain differently, but also everyone deals with pain differently. So some people, we actually call us up and they ask us, well, why can this person cope better than this person? And so it highlights the psychological impact of pain. Some people are just able to cope with pain perfectly fine. For others, it can have a really devastating impact on quality of life. But this is especially if there's some kind of detriment to the well-being, and this is why it's so complex and layered. It can be influenced by other things like, beside tissue damage, like life stage, mental health, social factors, physical factors, lifestyle factors. And so it's not just neurobiology, but there's psychology and a social component to pain. And so in other words, you have things like personal beliefs or environmental factors that can make a big difference to how we experience pain, how we manage it, how likely it is that it will persist. And so, for example, if we're thinking about our condition purely from a mechanical perspective, in our brains, we might develop a belief system that doesn't seem to rationalize or understand why we need to exercise and move more, or why something like load-bearing activities and muscle strengthening could actually help in your knees or your hips. So the processing of pain is really carried out in a lot of different parts in the brain, but it's this model here that recognizes various ignition cues, so fear, attitudes, beliefs, memories, damaged tissues, even your circumstances in your lifestyle can play into that part of the pain experience. So it's a model here that gives us the understanding of both the biological basis of pain, but also acknowledges that even though processes are happening in the brain, they manifest themselves in very real, very anatomical and biological ways. So thoughts, fears, emotions, these are all seen as nerve impulses, which have some kind of electrochemical consequence in the brain, just as inputs from damaged tissues have electrochemical consequences in your joints. So in addition, you have stress, anxiety that can come with worrying about the condition worsening. And I guess although we know that pain isn't a conscious decision, it's not us, making that decision that we're going to experience pain today, we do know that conscious decisions and actions, like maybe choosing to avoid or engage in exercise, these things can make a huge impact on our pain. So mental health, I'm not going too much in today because we are focusing more on that next week. But there is no doubt that having a chronic physical health condition such as OA or RA can have a negative effect on your mental health, which can commonly manifest as depression or anxiety. And we have very high statistics that demonstrate this. So studies show that there can be anywhere from 14% to 48% of RA patients who might experience depression, and around 16 to 20% of people who live with OA who might have a depressive disorder as well. And signs of this affecting people with arthritis could include withdrawing from friends, worrying or fearing things that haven't happened yet. An example of this could be needing a surgery. It could be that you're avoiding medical appointments or social situations. It could be struggling with healthy routines like healthy eating and exercises. So with arthritis, it's not just about the physical pain, but the emotional toll it can take. And what's unfortunate here is that sometimes they do feed into each other and they can create a very tough cycle to break. And so the pain and limitations from arthritis can definitely lead to feelings of sadness and hopelessness, which can, I guess, show in some behaviors, and it can make it harder to manage the physical symptoms and stick to things like a treatment plan. Catastrophizing is another layer to the already complex experience of pain. It really occurs when our minds take a very dramatic turn, and it can be like putting fuel on the fire. So it intensifies the pain and can make coping even more challenging. So catastrophizing can be defined as an exaggeration of potential negative outcomes of a situation while minimizing or ignoring any positive aspects. It's like that tendency to just envision the most bleakest kind of outcomes in the situation you're in, and can come about for a number of different reasons. Often it's not knowing if your condition is going to get worse or stay the same. Sometimes it could be worries about the condition and its impact on your life. So sometimes when you don't know about the condition or how successfully it can be managed, this can lead to being stuck in a very unhealthy mindset. And this is often because we don't have good information out there, or we can't locate a team of health professionals around us to help us not be so worried. But when you're catastrophizing, your mind has an ability to magnify pain and consequences, which can make us feel a bit more worse than what it actually is. Not only does this increase distress, but it can really affect how we perceive and manage our pain. So just recognizing if this is a part of your pain experience and this is something that you possibly do, by addressing this catastrophic thinking and finding healthier ways to cope, this is what can really help with breaking free from a cycle of pain and distress. And so there's so many studies that exist that look at this relationship. And one in particular that looked at whether targeting catastrophizing could be an important component of a comprehensive pain management plan. And they looked at this specifically in people living with OA, RA, fibromyalgia, and other musculoskeletal conditions. And this study reviewed a number of different published articles, like cross-sectional and prospective studies, in which pain-related catastrophizing was assessed in context of one or more rheumatic conditions. And because I guess results confirmed that catastrophizing was positively related to the reported severity of pain, affective distress, muscle and joint tenderness, pain-related disability, poor outcomes of pain treatment, inflammatory disease activity, researchers highlighted that addressing this behavior and this mindset can be very effective for pain management, and suggests it's a worthwhile target for both psychosocial and pharmacological treatments. So they suggest that it could even help with how people respond to their medications if you're managing your rheumatoid arthritis with medication. So we have a lot of different natural chemicals that are released in the brain, which are connected to tiredness, stress, anxiety, depression, catastrophizing. And interestingly, they're very similar to the chemicals that are used to communicate danger in the body or damage. And so with the sensitized nervous system, I want you to imagine it's like it's like a volume dial. So pretty much these chemicals have the ability to turn up that volume on your pain and make it worse. But thankfully, it actually works the other way as well. So natural chemicals associated with happiness and pleasure and desire, all these things can actually have the ability to turn that volume dial down. So this is a very powerful system in which some people have related it to a medicine cabinet in the brain. By doing things that are enjoyable or meaningful to you, you can actually become more capable to harness this system. So there are a couple of different ways we can tackle the psychological side of dealing with arthritis. And first, we should talk about changing unhelpful thinking habits. So catastrophizing, we said, is where it's our minds have this tendency to maybe blow things up a little bit more out of proportion than what it needs to be, or ruminating, where we keep going over and over things that are causing us to stress and worry about situations that don't exist. This can happen with pain. And so we have techniques like cognitive behavioral therapy, which are so effective for changing this. It's there to help you learn and challenge the negative thoughts and replace them with healthier ways of coping. And so this technique is there to help you recognize negative thought patterns and swap them out for more positive ones to help you really break free from patterns of negative thinking and ruminating.
Yeah, good.
I'll just
How are you?
that one. Okay, perfect. The fear of pain is another one, which can really amp up how much we're hurting. So techniques like mindfulness and relaxation exercises can really be effective for managing fear and anxiety, therefore making our pain feel less intense or less severe. Then there are inaccurate beliefs about the condition, where it results in thinking that we should avoid doing normal stuff because of our pain. But avoiding activities can actually make things feel worse in the long run. And so by gradually easing back into activities, and maybe some of us need that guidance of a healthcare professional to help us regain that confidence and reduce that disability over time, can be very effective for long-term pain management. The last thing to talk about is extreme guarding. Not sure how many of us this relates to, but when we're super cautious and we limit our movement because of pain, this can actually make pain worse by messing with how our brain processes it. So physical therapy, movement-based interventions, these are very effective for helping us get back into moving safely and reduce that pain by getting things back to normal in our lifestyle. And so these are just some of the psychological aspects that can be addressed to make a really big difference in your long-term management of your arthritis. It is all about finding what works best for you and what your preferences are. But when it comes to supporting that nervous system and addressing underlying mechanisms that cause that nervous system to become hypersensitive to pain, there's really no one-stop shop. It should involve a comprehensive approach that involves a number of different things that help reduce things like stress, promote relaxation, and just create that sense of security. So these are just some of the ways we can actually support that nervous system, help it feel safe again, so we can actually start to gain a bit more control over our pain experience. So deep breathing, such as diaphragmatic breathing or box breathing, is very effective for activating the body's relaxation response and calm the nervous system. So in a couple of weeks, when we have our guest speaker here, she's actually going to run you through some of the breathing techniques that are very effective for engaging that parasympathetic nervous system and helping release those natural pain relieving chemicals in the body. Mindfulness and meditation, we talk about this a lot, but these very effective for reducing stress, increasing feelings of safety. You have regular exercise and healthy lifestyle habits. These are big factors that can impact how the nervous system functions. You also have the other aspects of managing the condition, like it is very important to stay connected with others. So spending time with loved ones, engaging in supportive relationships or support groups, feeling connected to others can really have a big impact on the nervous system's response to stress. Could be creating a safe environment, setting boundaries, even seeking therapy or counseling. So if you feel that addressing the psychological component is something that could be worthwhile for you, and it's something that you want to explore, you're open to it, there are so many options and pathways that are actually available to you. Psychological counselling, for one, it offers a very holistic approach to pain management, and it's there to address a complex interplay between physical symptoms, emotions, and behaviors. And so by incorporating this kind of treatment into your treatment plan, you can gain very valuable tools to help support and improve your quality of life and well-being. And so some of these services are actually covered by Medicare and private health if you have it, and their services can be very valuable if you, especially if you find that you do have mild, moderate, or severe anxiety. If you do have more mild or moderate anxiety, it's not on the more severe kind of level. Online therapies can be just as effective as face-to-face therapies. They follow the same principles as cognitive behavioral therapy or behavior therapy, and you can work through some of the programs yourself. There might be support from a therapist that's available online, but the therapist will help you apply what you've learned to your own life. You might talk to them on the phone, by email, text. There might be an instant messaging feature, but online therapies are very easy to access. They can be done from home. And so when it comes to the benefits of face-to-face or benefits of digital services, I guess there's more benefits to mention here, but these are just some of the few that come to mind. They're there to challenge catastrophic thinking. So they're there to help you recognize patterns of negative thoughts and help you reframe them. They're there to give you coping strategies and address any emotional distress that could especially be linked back to your pain. The benefits of digital services include all the above, but it gives you that convenience, that accessibility. It's very affordable. Some are even available for free, and they're supported by evidence-based and clinical guidelines. So when these apps are being developed, they go through extensive quality assurance methods and processes to make sure that they're going to be appropriate for their intended use. So if you're looking into this and you're just getting started, these are some very effective and very good starting places. We have the Pain Management Network, so you can see there's a link there. You can find a local psychologist by going on findapsychologist.org.au, or you can call this number. If you go online, you can actually filter through some of the psychologists that are available, and you can filter through their specialist areas, and some of them specialize in chronic pain or CBT. You can also search for some by postcode. So look for someone that's going to be within your proximity. And then we also have Pain Australia, which have a number of different resources and toolkits available for you to use on the beginning of your journey here. So just to summarize this session, we do recognize that all pain experiences are unique. They're different for everyone, but they're a normal response to what your brain thinks is a threat. It's an alarm system that's being activated. But the way we experience pain is influenced by a lot of different things. We are very social, spiritual, physical, and mental beings. So there are other things besides tissue damage that can affect how you experience pain. And chronic pain is a whole of life problem. It can affect your quality of life. And so effective management needs that whole of life approach, which is why we talk about, counseling and therapy in that ongoing management. So what I'm going to do, that brings us to the end here. I'm going to open up the floor to some questions if you have any for me. Ooh. Does anyone have any questions? Excellent. So if we don't have any questions, we might leave it here today, everyone. Thank you all so much for attending. Hopefully we'll see you at the next one for mental health and arthritis. Covers different aspects again. But all the best. If you have any questions, you can always email us or call us and we can continue to chat about all these different topics.
Thank you.
Thanks, everyone. Recording.